the foreskin is very rich in blood vessels. So the removal of the foreskin reduces the surface area for viral exposure. It reduces the surface area for viral exposure and the chance of micro tears. Welcome back to this channel. Now we are doing a video about HIV and AIDS. There's this common notion that whenever someone gets intimate with someone who is negative, like someone who is positive rather, they'll automatically contract the disease, that is HIV and AIDS. Now this is about contracting HIV and AIDS from women to men. Like when a woman is positive and you as a man, you are negative, there are higher chances you can get intimate and not contract the disease. Now if this is your video, this is the time where you subscribe to my channel, you like the video, and if you want to share with someone so that many people can know this. It's time to demystify the myths. Let's jump right into it. Now, point number one: if you're a woman, or if you're a girl, or if it's just by accident that you get intimate with a woman, there are higher chances you won't contract. There are higher chances you will contract the HIV and AIDS. You won't get it. After testing, you'll find yourself negative. Now, point number one: woman's arousal. Like I'm trying to say, when a woman is aroused, properly aroused, that is the point. Like when a woman is properly aroused, it increases like natural lubrication, which can reduce friction during sex, and lowering the friction. Like there's a likelihood of the vaginal or the penile micro tears. Like micro tears create the pathways for HIV to enter the bloodstream. To mean when there is lubrication, not even lubrication, like arousal, then the woman releases whatever they release, then chances are reducing. Because lowering the likelihood of the vaginal or penile microtears, and the microtears are the things that carry the semen or carry the fluids that infect us with HIV and AIDS. Now the limitations are this: it doesn't necessarily mean that when the woman is properly aroused you can't have sex, but like you can't get AIDS, but the chances are reduced. The chances are minimal. Okay, the chances are minimal. Let us talk about point number two: male circumcision. When you as a man, you are circumcised and you are having sex with a woman who is infected. Now study shows like female to male HIV transmission is reduced by 60%. To mean there's only 40% of transmission, but it's reduced by 40%. Why am I saying this? Because the foreskin is rich in blood vessels, which is a key factor in HIV infection. The blood vessels. The foreskin is very rich in blood vessels. So the removal of the foreskin reduces the surface area for viral exposure. It reduces the surface area for viral exposure and the chance of micro tears. Are you getting the point? To me, when you're circumcised, automatically 60% chance you won't get HIV AIDS. Now, limitations must also be there, because if it's 60% chance reduced, to mean you are still exposed in how many percentage? 40%. Now, in conclusion, what am I trying to say? I'm just trying to say that the chances of HIV transmission can be slightly reduced if the woman is well aroused, reducing tears and friction, because it's always about the friction and the tears, then this will happen. The man is circumcised. When the man is circumcised, the chances of getting the virus are reduced. Now, after the two measures have been taken, it's not all, because you cannot substitute arousal and circumcision over the measures. For example, the use of condoms. You must use condoms for protections, obviously. The use of the preps. You must use preps. You can't now not take preps just because you're circumcised. Ensuring your HIV partner is viral suppressed. Yeah, you must ensure that your HIV partner is viral suppressed to reduce the rate of infection. Now, if this video was helpful, thank you. Subscribe to our channel and share this video to someone who might need it. Ciao.